Yo, what it do? It's your boy Bruce back here with another YouTube video. So y'all already know what's going on. Alright, so today we're going to do the removal of a colostomy bag. So a colostomy is a surgical procedure where they create an opening in the colon. So we know stoma is an opening, so it's the opening of the colon. So the reasons why you would see some of the reasons why you would see a colostomy bag is, colon cancer, you have trauma, injury, inflammation of the bowels, obstruction of the bowels, and, a congenital disease, a disease that they was born with. So you want the stoma, the opening of where the colon is, you want it to be pink, red, moist. You don't want to have no nerve ending. It shouldn't be painful to the patient. You want to empty the bag when it's 1/2 full. Change the appliance every 3 to 7 days, if sooner if it's leaking. So if you have any problems with a colostomy bag, remove it and just put another one back on there. So if you see any skin irritation, if the stoma looks reacted or looks bulging or something like that, if you see any blockage, infection, or even high output, a lot of stool coming out, those are kind of complications that you will see upon the colostomy. So, the colostomy is to divert the stool away from the disease or the inflammation, or, so it allows the colon and the rectum to rest and heal after surgery or trauma or disease. It's bypassing the blockage in the colon, preventing stool contamination and providing a permanent route for stool and elimination. So it's providing a permanent route for stool elimination. So those are some of the benefits of it. The risk, like I said, is the skin irritation, infection, stoma complications like bleeding, prolapse, and retraction. And we have bowel obstruction to the scar tissue could be a problem. And, psychological impact of body image is also a problem. So we should look out for that. Signs of depressions or something like that, or body image. So those are some teachings about the stoma colostomy bag. So I'm gonna go ahead and perform a procedure demonstration. Knock, knock, knock. Hello, how you doing? My name is Bruce. I'm gonna go ahead and remove and clean your colostomy bag. I'm gonna go ahead and check your wristband. Hey, how you doing, Teddy? So, like I said, you go ahead and do that. Provide privacy, introduce myself, identify the client, and perform hand hygiene, gather your supplies. And so right now we'll go ahead and put these gloves on. Removing a colostomy bag is a clean technique, not a sterile technique. So we'll just do the standard precautions, gloves, and wash hands. So under the colostomy bag, we'll place a towel so we don't have any complications right there. So right now we'll just check out the colostomy bag, see if there's any complications. On the outside, see any clear indentation. So inspect, assess. Okay, it looks good. So we're going to remove the adhesive off the colostomy bag on the back, slowly and carefully, so we don't damage the skin any. So remove the colostomy bag, dispose the colostomy bag, and then go ahead and clean the excess stool around the stoma using a warm wash towel. So use different parts of the towel. Okay, so now we will inspect and assess the stoma now that we have it clean. All right, so we don't see no excess bleeding. We see that it's pink and red, so it's getting circulation. There's no pain, no tenderness, no scary indentation. So we'll go ahead and now we'll go ahead and pat dry. Make sure We get the skin nice and dry. Make sure that the patient has no skin allergies to these colostomy bags that show up in skin irritations. So now we will put the colostomy bag back onto the patient, removing that adhesive and then putting the bag onto the patient. Removing, clipping the bottom, making sure the bag is closed, and removing gloves and hand washing.